You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, what every person that is eligible for Medicare needs to know about their options. With us, we have an expert on the topic. She is the medical director at JenCare. She's in charge of their primary care. Dr. Aarti Agarwal. Dr. Agarwal, welcome to the program.
Thank you for having me, Randy.
Now, for people that don't know about JenCare, who's the typical patient? And what are the different services you offer? And how do you become qualified to be part of it?
So I'd be happy to. So JenCare is a comprehensive primary care program for seniors that delivers better health outcomes. It's really an amazing program that's available to seniors who have Medicare. All you have to do is sign up with a Medicare Advantage plan, either with WellCare, Cigna, or Humana, and you can be with a patient with JenCare. So the way we do this is in several ways. We have a proactive approach to our patient care. So our aim is to identify problems that patients have before they become so serious that you end up in the hospital. So we have a very robust preventative care program where on your first visit, when you come and see us, you're going to have a whole battery of tests. The doctor is going to ask you all kinds of questions about your medical history. But not only that, we're going to obtain all of your old records from your previous doctors, previous hospitalizations, to get a full understanding of what your healthcare has been like in the past. That way, we're able to detect any problems early, manage them, and keep you healthy for longer.
Okay, now, we've had a lot of discussions both on the phone and in my green room. And one of the reasons why we wanted to do this interview with you is there's a lot of people on Medicare or lost in the system that are using like urgent care for their health care,
right.
Or they're using hospital emergency rooms for their health care because they say this is all I can afford.
Right.
And you're saying they don't even know their options.
Right.
Is that right? There's a lot of people, hundreds of thousands of people that don't know their options?
So the problem with healthcare today is that it is very fragmented. So a patient will go and see their primary care doctor once, and their primary care doctor, the typical primary care doctor has so many patients on their panel. They have thousands of patients on their panel. So it's not that they don't want to see their patients, it's they don't physically have the capacity to see their patients more than maybe 2 or 3 times a year.
Okay.
Now, our model is totally different. So the way that we're able to be so available and accessible to our patients is that our doctors only have 400 patients maximum on their panel.
That's like 30 a day, 20 to 30 a day, as opposed to 60 a day.
Absolutely.
Is that right? Okay.
Mm-hmm. So we see.
And it doesn't cost more for that?
No,
okay.
It doesn't. So it's really amazing, accessible care that you can have this concierge feeling, but you're not paying, $2,000 a year or whatever fee to have this kind of access to your primary care
So
doctor.
a PPO, if you're over 65 and you wanted to get a PPO or you wanted to be able to have access to care, it's going to be thousands of dollars or more than $1,000 a month. And this is just the copay.
Correct.
Right? And some people pay like little or no copay. Is that true?
So with our model, there is no copay to see your primary care physician.
Okay, so they could see you.
They can see me as often as they need to, and they will not pay a copay for that.
The traditional, because we were talking about this, you say it's a fragmented system. So tell me about the typical Medicare experience, how it's done elsewhere, and what you want patients to know about JenCare, the difference.
So what's done elsewhere is that a patient will go and see their primary care physician, and they'll identify, some problems that are going on, and they'll send the patient to all sorts of different specialists and for all sorts of different tests in different areas. Now, once the patient goes to see, the specialist physician, they're going to end up seeing that doctor forever. So they're going to be following with not only their primary care provider, but also these other specialists for a very long time. And none of these doctors are communicating with each other.
So they may be sent to a cardiologist as a specialist for their diabetes or whatever.
Right.
And the primary care physician is like out of the loop?
They're totally out of the loop.
Interesting.
So there's no communication. The cardiologist is not following up with the primary care doctor to say, thank you for sending me your patient. This is what we discussed, and this is how I'm going to change their management. There's just no time or capacity for doing that. And so the cardiologist, there's a lot of redundant care because, the cardiologist may be doing certain tests and the endocrinologist may be doing certain tests, but nobody's communicating with each other. And it's a very dangerous place for the patient to be because they could be on, these medications from one doctor, these medications from the other doctor, and they could be interacting with each other. They may be doing the same thing, and nobody is really paying attention.
Is that right? Really?
Yes. And so what is really needed is a comprehensive system and a doctor who's going to coordinate that care.
So at JenCare, you're assigned a primary care physician?
Correct.
That you could see once a week, once a month?
Right.
Or every day?
We actually expect our patients to see us once a month. That's
Really?
what we want. If there's something else going on, you have something more acute, then you can actually see us even more often than that.
But what if you're feeling pretty good? You still want them to drop by once a month?
Absolutely.
Really?
So we want to know what is going on. If there's nothing going on, that's great, but we need to stay on top of all of the preventative care that you need. It's just like your car, right? So you're not going to wait until something breaks down to take your car to the shop. You're going to get your oil changed. You're going to get everything checked. And it's the same way with your body. We want you to come in every month so we can check in with you, make sure that everything's going okay.
And there's no copay for that. Sorry to interrupt.
There's no copay.
So if somebody's watching this, and if they call JenCare, they could actually see a doctor today, in many cases.
Yes.
Is that right?
Absolutely.
And you guys give your cell phones out.
We do.
I spoke to I think he was a chief medical officer. Mm-hmm. He said when he interviews the doctors to join JenCare, mm-hmm. he says, we give our cell phones to our patients.
Yes.
He says if they don't want to do that, they're not hired.
That is correct. So we want to be extremely accessible and available to our patients. So if there is something going on, we don't want you to feel like, well, I can't get in touch with my primary care doctor. I'm going to go to the urgent care or I'm going to go to the ER to obtain my care. No, we want to hear from our patients.
Do people actually call you on your cell?
Yes, they do.
Or text you?
So both. So I recently had a patient who he fell and he went to the ER and he called me on my cell phone from the ER. And he said, hey doc, I'm so sorry to bother you, but I fell and I'm here in the emergency room and I think I'm okay. And I said, well, thank you so much for calling. I'm so glad that you let me know what was going on. I want you to see me in the office. From what it sounds like, I don't think you'll be admitted to the hospital. So I'd like you to come see me in the office tomorrow, and we'll see how you're doing. So he came in the next day, he saw me, we talked about what happened in the emergency room and I had already obtained, his notes from what had gone on there and the x-rays and everything seemed fine, but he was still having a lot of pain. So I said, well, what did they give you, to manage your pain? And he said, they didn't give me anything. They handed me 2 ibuprofens and sent me on my way. So I said, well, that's not okay if you're still having pain. So let's, give you some medications to help alleviate that. And he was fine. And I followed up with him, 2 days later to make sure that he was still feeling well. And we were able to manage that. And that probably saved him another ER visit or another urgent care visit to manage this pain that he would have still been experiencing over the weekend.
So people that are outside of this JenCare model that you're offering, that particular person might have just had to be in pain until it just kind of wears off, works itself out.
Exactly.
Or make an appointment with their doctor that may take 2 months.
Exactly.
They call you, you say, I'll see you here tomorrow.
Exactly.
Is that common or unusual?
It's extremely unusual.
Okay.
So to have this kind of access to your physician, people pay thousands of dollars to have, what they call concierge medicine. And when I ask these companies, so, what makes you concierge exactly?
Concierge, for people tuning in, may mean having a doctor that you pay like $5,000 a year and he's your doctor, she's your doctor.
Exactly.
Okay.
And what you're paying for there is you get their cell phone number, You're able to go in without an appointment. Your appointments are perhaps a little bit longer than a typical, patient appointment. And, they'll make referrals to specialists and for lab tests and other types of tests for you. Now, I always come back to them and say, that is the bare minimum of what we do for our patients at JenCare.
I mean, if there's so many people,
right,
like in Atlanta, that are on Medicare, but they're not involved in a program like this,
right,
is it they just don't know?
They don't. So the way that our patients find out about us is that, they hear about us from their friends and family, and then they go and tell their friends and family, and then that's how we're getting most of our patients, is that they're learning, it's all word of mouth.
Now, I know the answer to this question, but I'll give it to you anyway. What if somebody doesn't have a ride? They're poor, maybe they don't have transportation.
Absolutely. So what I love about JenCare is that we care for seniors who have so many barriers to access. One of the big barriers to access to healthcare is transportation. So a senior, they want to go to the doctor, they want to get a test done, but how am I going to get there? I don't have a ride, I don't have a car. There's so many reasons for this. We try to break down as many of those barriers as we can.
So you'll pick them up and drop them off
to
their appointment?
Absolutely.
Really?
So if you live within 8 miles of the center, we will pick you up at your home and bring you to the center, and we will take you back home. So JenCare is really, I consider it a one-stop shop. So we try to make things as convenient for our patients as possible. So not only will we bring you to the center, we provide so many more things in the center than just the primary care physician. So you see your primary care physician. We also have medications on site that patients can pick up. So whatever medications that I write for, the majority of them will be available in the clinic.
Right there.
Exactly.
Okay.
So the patients can pick them up, ask the doctor any questions that they may have about their medications. And then we also have a lot of other facilities available there. So we have other subspecialists that are in the clinic. We have X-ray, we have ultrasound, we have all of these things that our patients don't have to run around all over town to receive all of this different care. They can just come to JenCare and we'll take care of most of their medical needs, and they can go and be dropped back home.
I'm Barbara, and I have been in Atlanta for 20 years. I have 7 grandchildren. Then I have 5 great-grand. I got a lot of good reasons to stay healthy, a lot of them. Before I came to JenCare, I was running all over Atlanta to go to different doctors. And with JenCare, I'm in one spot for everything.
Relationships are important. They are the basis for treatment. Barbara, she's amazing. She's a wonderful lady. It's a joy to take care of her because she does all of the great things that I ask her to do.
My doctor and I get along fantastic. He's like a son that takes care of his mama. They show me how to live a better life. They take the time out to hear what I gotta say. Besides the grace of God, they're the reason why I get up in the mornings.
So to qualify for your program, you have to be 65, right? You have to be 65, and I guess it's
you
even
have to
as
be
low as
eligible,
55.
correct. So you just have to be eligible for Medicare.
For people that are currently on Medicare, they're not involved in JenCare. Okay, so if they live 8 miles away, you could pick them up, take them to the center, and do a consultation. Are they surprised? Like, do they ever say, like, this sounds too good to be true? Or how come I was never told about this before?
Absolutely. There's so many patients that we have touched that are so surprised and appreciative of what services we provide. So they get absolute VIP service when they come to our centers. They're picked up in their homes. They are dropped off in the centers. They come in, they have, lovely snacks to eat, and,
Okay.
and it's a wonderful experience. Then they come and see their primary care doctor, who really has a genuine interest in what is going on with their lives, what is going on with their health, and what are all the ways that we can do, what are all the ways that we can improve their health. So I had this lady come and see me for the very first time. She was a new JenCare patient, and she had just uncontrolled diabetes. She was feeling terrible, telling me how tired she was. She was urinating all the time and just feeling absolutely terrible. She didn't feel like she was contributing to her family life very much, and that she was just a burden to everyone in her household. So, we talked and we ran some tests, and I saw that her diabetes was totally out of control. So I saw her again just in the next 2 days. And I said, what's going on here? How did this get so bad? And she said, well, my previous doctor, I only saw them, maybe once a year, and they had me on this medication that, I had to take 4 times a day, and I just can't do that. She was very honest with me and said, I can't do 4 times a day. And she also shared with me that she wasn't able to really control what she was eating, and she had indiscretions with that.
Okay.
So we talked about nutrition and some easy things that she could change about the way she eats. And I changed her medication as well to something that would be much more easier for her to handle. So we changed her medication to something that was only twice a day. And she did very well. So what we ended up doing was seeing each other every week to adjust her medications. And within 2 months, she was completely controlled. And she was a different person.
So there's no way you could have done that with the traditional model of seeing them every 6 months?
Absolutely not.
So really every week?
Every week.
So it just allows you to really stay on top of it?
Absolutely. So because she had something very serious going on, I saw her as often as she needed to be seen in order to get her health problems under control. And that is what we do. And she's doing so much better. She's continued to have, just a complete turnaround of her life. She feels so much better, so much more energetic. She's able to spend time with her family in a meaningful way that she had been lacking in the past.
Now, we've had the program for 20 years.
Right.
I've been interviewing medical doctors, and I've had primary care doctors that they'd like to practice this. They go, I didn't sign up for only being able to spend 5 minutes with my patients. But really, if they're working for someone else, this is what they have to do.
Right.
And when you tell your colleagues that work out in the real world of where it's not like this, I mean, isn't this the way every medical doctor wants to practice?
Absolutely.
Where they could actually really be a doctor?
Right. So I think doctors love seeing patients and building those relationships, and our system really allows them to do that. Our doctors love their patients. They love making the difference in their lives, and not only by changing their medications and doing different tests and making sure that they're doing okay health-wise. We want to make sure that their whole life is better. So not only do we provide good medical care, great medical care really, but on top of that we have acupuncture services, we have nutrition classes, we have exercise classes in the clinic. So it's really a true...
And Medicare is paying for all of this?
Correct. It's like a community for the patients to be part of. And we're very proud to be able to provide that.
Now, I asked you, I thought, because most medical practices are not set up, they don't make any money on Medicare. I'm quoting them.
Right.
Your reimbursement is based on, and I'm probably messing this up a little bit, but based on keeping them well. Is that right?
That's correct. So the whole difference about JenCare is accountability. Okay. So your doctor doesn't stop thinking about you when you leave the room. Most doctors can only really give you attention when you're right in front of them. For us, we want to make sure that once you leave the office, you're taking your medications, you're exercising, you're eating the right foods. So we're going to follow up with you and make sure that, if I sent you to see, the cardiologist, that you actually went to see them. I had a patient just the other day who, she was having a heart problem. We identified it in the exam room, and I said, you need to see, this specialist by tomorrow. So I called her up the next day and I said, well, how did the visit go, with Dr. Smith? And she said, well, actually, I didn't make it. I got stuck in traffic and, I couldn't get there. And so I was able to then call Dr. Smith and say, I'm so sorry that, my patient wasn't able to make it to your office, but can you please get her in either later this afternoon or the next day? Because it really was that important. Okay. And the patient was so surprised that I had followed up to actually see if she made it to the cardiologist's office. But I said, this is very important. I don't send you to specialists, just for nothing. It's a very important situation. So I wanted to make sure that you went to see them. And we That's what we do for everything. We always close the loop. So if I send you for a test, it's not just up to you to get it done. I
So
am
you
going
follow
to
up with it?
Absolutely.
Really? That the physician
Yes.
makes the call?
The physician, we will make sure that you have an appointment, but I will make sure that you got the test and then find out what the results were.
Now, you're the medical director of primary care.
Correct.
With JenCare. So you have a meeting with all the primary care physicians within the group.
Yes, I do.
And did you guys keep stats on who has the healthiest patients?
Yes.
Who keeps their patients out of the hospital the most?
Yeah, absolutely.
Is that right?
Yes.
Also, wait times. You know, the seniors are always complaining that they have to wait too long in the waiting room. You said there's really not much of a wait.
There's not much of a wait, and we actually track that. So we actually want to make sure that our seniors are not waiting a long time, that they really are getting VIP service for their medical care. And so we track their wait times and make sure that nobody is waiting more than 30 minutes at the maximum. We would rather have that down to 0, but because we accommodate walk-ins and we try to be very accessible to all of our patients, some wait times can't be helped, but we definitely keep track of that and make sure that nobody is waiting too long to see the doctor.
In Atlanta, would you say there's tens of thousands of people that qualify for this Medicare Advantage program?
Absolutely.
That just don't know that this exists?
That's correct.
Really? And they're being underserved in their medical care.
So they're still just part of that fragmented system where they're only allowed to see their primary care doctor a few times a year. So, for example, most diabetics need to be seen at a minimum of every 3 months by their doctor. So perhaps those patients are getting to be seen that often by their primary care doctor, but there are no patients that are being seen by their doctor every month.
If you're a senior, now is the time to select your doctors and benefit plans for 2019. JenCare Senior Medical Centers give you access to doctors who actually listen.
I find JenCare doctors have probably, I don't know where they learned it, to look at the human touch.
Call today to select the kind of doctor and care you deserve.
That's why I feel good about JenCare.
JenCare loves seniors and accepts many Medicare Advantage plans.
People get lost. I always hear stories. People get lost in the system. If somebody's tricky, you can't get to the bottom of why they're feeling lousy. I guess you get together as a team and maybe pull in specialists, things like that. Could you elaborate on that?
Yeah, absolutely. So if a patient's not feeling well, the first thing is they're going to come in and see their doctor. So as the primary care doctor, I'm going to assess them, do some tests, whatever's within my scope. And then we'll identify, perhaps you need to see, this specialist or that specialist. And then we will coordinate their care. So I'm not just going to defer the care onto a different doctor. I'm going to follow up with that doctor and make sure that we have a comprehensive, coordinated plan for that patient to make sure that they are getting better.
Compliance, many of the doctors will complain, it's hard to get patients to do what they say. But at JenCare, you don't have that much of a problem because you know these people. You spend more time with these people.
Right.
Is that part of it?
It is part of it. So again, it comes back to building these trusting relationships with our patients. So our patients know that we have their best interest at heart, and they can ask us the question. So if they're confused about why they're taking a certain medication, I can explain exactly why they're taking it, why it's important, and I'll even tell them, okay, these 5 medications are very important for you to take, but these are less important. And so if you're not feeling bad or you're not having this symptom, you don't need to take those every day. And a lot of patients don't have the understanding that some medications are important to take every day, and some of them are really just to use as needed.
Now, do you ever get people, so you give them a prescription, they go home, and then their family's going, what is this for? And they forgot.
Right.
They can call you on your cell and get clarification.
So they can call me on my cell, they can call the clinic. If they leave a message, I will always get back to them the same day. So
I would feel guilty calling my doctor on their cell phone. Do they feel guilty? Do they say, I'm so sorry?
Yes, they do. Actually, my patients say, I'm so sorry to bother you. And I always tell them it's not a bother. I'm happy to hear from you, and I'm happy to have the opportunity to answer any questions that you might have.
Okay, good. Now, we are completely out of time. We haven't even talked about your credentials. I mean, you have a great background. If you want to talk a little bit about your background.
So My mission has always been to serve the underserved. So I have worked in global health in the past. My training was at NYU, and I primarily worked at Bellevue Hospital, which is a big public hospital in New York City. I also, when I would transition down to Atlanta, I worked for the CDC, where I was working on outbreaks and malaria, and so I was still doing global health. And then after that, I still wanted to serve the underserved in my community. And so I joined the faculty at Emory, and I was primarily based at Grady Hospital, which again is a big public hospital in Atlanta. And what took me away from academic medicine and research, and then I found JenCare. And the mission of the organization at JenCare is really to serve the underserved in the very best way possible. So we address all of their barriers to care and give them a comprehensive, coordinated plan and a beautiful relationship with their primary care physician.
When you heard about this the first time, were you surprised?
I was
like, wow,
very
this
surprised.
is what I want to do.
Yes, absolutely. I was so surprised that there was an organization that was actually doing this, that was breaking down all those barriers to care and providing VIP service to our patients.
We are completely out of time. How does somebody get started? So somebody's watching this, they're 65 or older, or maybe they're on Medicare and they've never heard of this kind of a program before.
Right.
Where do they start? What's their first move?
So the first thing is call one of our clinics or come into the office. We'd be happy to introduce you to our patients, and they would tell you all about how JenCare works. You can meet our doctors, you can meet our staff, and there will be somebody there to help you transition from your current plan onto a plan that we take, and you can sign up to see a JenCare physician.
And they could start seeing a doctor like right away?
Right away.
Is that right? We were joking in our green room where you said they could actually talk to any one of our patients in the waiting room, but they have to hurry because nobody waits. Or it's a very short wait. You did say that.
That is true. That is true. It's a very short wait. We try to give the best possible service that we can to our patients because they deserve it.
And patients all the time, you say like, this is like amazing.
It is.
And they tell their friends.
It's absolutely. Most of the patients that we have, it's because they tell their friends, they tell their family, and they all sign up, and they've been very happy with not only their health outcomes, but the service that we provide for them.
Okay, great. I want to thank you for coming to the show. Great stuff.
Thank you for having me.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.
If you're a senior, now is the time to select your doctors and benefit plans for 2019. JenCare Senior Medical Centers give you access to doctors who actually listen.
I find JenCare doctors have probably, I don't know where they learned it, to look at the human touch.
Call today to select the kind of doctor and care you deserve.
That's why I feel good about JenCare.
JenCare loves seniors and accepts many Medicare Advantage plans.